The way of learning. Today's topic is leukemia, exhibited for staff nurse interns. Leukemia, brief concept. Leukemia is cancer of the body's blood-forming tissues, including the bone marrow and the lymphatic system. First question is, which malignant type neoplasms are related to the abnormal, uncontrolled multiplication of white blood cells? Option A, carcinoma. Option B, sarcoma. Option C, leukemias. Option D, lymphomas. Correct answer is option C, leukemias. Next one is most common type of leukemia in older adult. Option A, acute myelocytic leukemia. Option B, acute lymphocytic leukemia. Option C, chronic lymphocytic leukemia. Option D, chronic myelocytic leukemia. Correct answer is option C, chronic lymphocytic leukemia. Next one is most common type of leukemia in children is option A, chronic myeloid leukemia. Option B, chronic lymphoid leukemia. Option C, acute myeloid leukemia. Option D, acute lymphoblastic leukemia. Correct answer is option D, acute lymphoblastic leukemia. Next one is a definitive diagnostic test for a leukemic is option A, leukocyte count. Option B, lymph node biopsy. Option C, spinal tap. Option D, bone marrow aspiration. Correct answer is option D, bone marrow aspiration. Next one is gold standard in the diagnosis of leukemia is option A, blood culture and sensitivity. Option B, bone X-ray. Option C, bone marrow biopsy. Option D, bone biopsy. Correct answer is option C, bone marrow biopsy. Next one is the clinical manifestations of a nurse should expect in a patient with all are option A, PTC, alopecia. Option B, anemia, insomnia. Option C, anemia, PTC. Option D, alopecia, bleeding gum. Correct answer is option C, anemia, PTC. Next one is while carrying a child with leukemia, a nurse should look for all the following except option A, fatigue and weakness. Option B, nausea and vomiting. Option C, increased weight gain. Option D, alopecia. Correct answer is option C, increased weight gain. Next one is the nurse cares for a patient with leukemia. The patient tells the nurse that he is having abdominal pain. The nurse understands that the abdominal pain is due to option A, persistent vomiting. Option B, intra-abdominal bleeding. Option C, side effects of drugs. Option D, hepatosplenomegaly. Correct answer is option D, hepatosplenomegaly. Next one is a child with leukemia having nausea should be offered option A, cold clear fluid. Option B, warm clear fluid. Option C, low protein diet. Option D, low calorie diet. Correct answer is option A, cold clear fluid. Next one is which of these beverages can be given to a child with leukemia if nausea occurs? Option A, orange juice. Option B, weak tea. Option C, plain water. Option D, carbonated beverage. Correct answer is option C, plain water. Next one is the primary reason for using prednisone in the treatment of acute leukemia in children is that it is able to option A decrease inflammation, option B reduce irritation edema, option C suppress mitosis in lymphocytes, option D increase appetite and sense of well-being. Correct answer is option C suppress mitosis in lymphocytes. Next one is the patient with leukemia is receiving busulfan and allopurinol. Nurse tells patient that purpose of allopurinol is to prevent option A alopecia, option B hyperuricemia, option C vomiting, option D nausea. Correct answer is option B hyperuricemia. Thanks for watching. Like, comment and subscribe the channel.